Okay, good morning, everyone. Thanks for hanging on with us. Sorry about the delay. Dr. Larry Earl here with NAOHP and Shanna Dunbar, who I will introduce in just a moment. Thank you all for joining us. I'm so glad you're here. I want to tell you why we're here. Uh, Over the years, I've been hearing the same story again and again from our members. A nurse steps into an occupational health or employee health role. Often they're talented, experienced. They've been doing great nursing work for many years, and they're eager to come into this new world of employee health, OC health, safety, and quickly discover there's no clear roadmap, no traditional training out there designed for where they're standing. Clinical foundation you've got, but the safety leadership piece has always been sort of an enigma, right? That's a different world, and the resources really just haven't been there. So, at NAOHP, we've built a lot of content over the years for program directors, managers, providers, sales and marketing community, of course. But when we looked honestly at what we had for nurses, specifically RNs, OHNs, navigating this transition, the gap was real. And here's something else that was interesting. We went to AAOHN with this, right? The Premier Professional Association for Occupational Health Nurses. And they saw the same thing. They were hearing the same things from their members. Same questions were coming up. So rather than each of us working around the edges of it, we decided to do something together. And so what you're joining today is the result of these conversations and course built from the ground up specifically for nurses and employee health professionals who are stepping into the safety leadership positions and want a real framework to stand on. So I couldn't be more excited to introduce the person who really helped make this real and bring it all together for us, Shanna Dunbar. So thanks for joining us today, Shanna. And, I think I'll just turn it right over to you because we've got a lot of folks here and limited time. So let's get to it. Uh-oh, Shanna, we lost your audio again. I see it coming on and off again. All right, while Shanna is messing with her audio, hopefully it'll come back, but here's what I'm going to do. I am going to just ask you all, I'm going to put up a little poll. So we've got something to do here for a moment. Tell me who you all are. What's your role today? Are you an RN, a COHN? Are you in safety? Are you an OC health professional? Are you in HR? Maybe you're something else. If you're something else, put it in chat because I didn't put something else up here. Maybe I should have done that as well. Let's see, do I already have something else? OC health RN, COHN, let's see. So mostly RNs. Interesting. Okay, great. So RNs may not have been specifically trained in employee health, OC health. Sean, how you doing? Still no audio?
I'm okay. Can you hear me now?
Okay, good. Yeah, we got you now.
Okay.
So that's all right. I just did this little interlude while you were messing with that.
You are on it, Dr. Earl. Thank you so much.
Office manager for occupational health. Okay, this is interesting. So mostly RNs in here. All right, I'm going to close this down because we've got Shanna back. So that's great. Okay. Close this. And I'm going to thank you for answering that. We have a nice active crowd today. So if you want to ask more questions and just shoot them in the chat and we'll get to them as we go along. Back to Shanna.
Thank you. So why employee safety and healthcare matters? And this is a question I want you to think about. When we talk about healthcare and safety, what comes to mind is patient safety. I mean, that's what hospital systems, that's their business. But the employees need to be safe to enhance the patient safety. And I just think sometimes this gets missed. So that's why this is especially an important topic to address in healthcare. We, of course, can do this exact same presentation for manufacturing, for construction, there's a lot to know as occupational health nurses in these areas, but we really wanted to hone in on healthcare specifically because Dr. Earl, of course, is working with provider networks. And my current clients, I've been working more with hospitals. So I want to thank you so much for introducing kind of your background, Dr. Earl. And I wanted to let everybody know, a little bit about my background. All of us in occupational health, remember, as RNs, we can help people kind of one-on-one. The difference is that occupational health nursing is in the public health nursing space. And what do we know about public health? In public health, we put systems into place to help our entire population, right? We want to put systems so the entire employee population gets healthier. And in occupational health nursing, that is what we're looking at. I always say from hire to retire, this is our population that we're working with. And you might hear, if you know anything or have been following me on LinkedIn or YouTube, I talk a lot about total worker health. Now, total worker health is really not a new concept. In fact, back in the 1980s, when I did my nurses training and started in occupational health nursing, I was so privileged to have some wonderful mentors who really taught this concept, how the intersection between worker protection and safety and worker health promotion is where you get the best results in terms of advancing employee well-being, making sure they're more productive, making sure workers are more engaged in their work. And now we know this is called total worker health. It's a phrase that was coined by NAOHP about 20 years ago, believe it or not. But it's not, any of us that have been in occupational health for any length of time know that we get the best results at the intersection of safety, health, and well-being. So just to give you a little bit of an understanding of where I come from as we start to talk about the value and importance of safety in the healthcare space. So what are some of the risks that we see in healthcare? Well, did you know that actual healthcare workers have the higher incidence rate? Dr. Earl and I just got the 2024 OSHA statistics. And do you know healthcare incidence rate, about 6 or 7 workers per every 100 worker are having an injury? That's higher than construction. That never used to be. But that tells us that we could be doing a better job at even preventing accidents in the healthcare space to begin with. And most of these, I would say, in my experience working with hospitals, a lot of these are preventable, like slips, trips, and falls. Why should we have any slips, trips, and falls if we are putting programs into place to make sure that we're addressing those, like putting up the signs, right, that say that it's a wet floor and guiding people around it instead of not addressing it as preventable. And again, this issue in healthcare, that safety systems often are solely focused on patient safety, and employees are sort of an afterthought. Here are the common workplace injuries for healthcare: slips, trips, and falls, like I mentioned. Musculoskeletal kind of risk because of patient handling. We know that patients are getting larger in America, and we have to figure out ways to handle these larger bodies in the healthcare space. Again, preventable if we put systems in place ahead of time, like lifts and things like that. Of course, needle sticks and sharps, as much as we double down on our bloodborne pathogen training and making sure people are very aware of how to prevent, we've got equipment now, like, back in the day, any of us that were nurses in the 80s and 90s, we didn't have those slick recapping needles and things like that. But even with that, we're still seeing, probably more than we want, some needle sticks and sharp incidents. And then this issue of workplace violence. This wasn't something we talked about even 5 years ago, but now we're starting to see more and more healthcare workers being kind of at risk for workplace violent exposure. And what about the cost of these workplace injuries? In the last couple of years, I've worked with 2 hospital systems that actually had a lower than average OSHA rate, meaning, I told you earlier, it's 6 to 7 injuries per 100 workers. They were having 2 and 3 injuries So very low incident rate compared to the national average. However, their workers' compensation costs were 3 and 4 times the average, meaning that they didn't have good internal systems in place to help better manage their workers' compensation claims. I see this a lot, and I see it throughout different industries where we think that a third-party administrator, our workers' comp insurance, maybe we have a managed care organization, everybody else is managing our injuries, and we don't, as healthcare associations, take really better control of what we have control over in the term, in, you know, even from injury reporting all the way through return to work and transitional work duties. We're not taking the responsibility for that. So this is another area that is a perfect spot for an occupational health nurse to be instrumental in keeping the costs of workers' compensation low. We also know, you know, transitional work programs are one of the most cost-effective programs any organization can put into place, where you invite people back into the workplace when they're not 100%. Let's say they can do 80% of their tasks, but they're not 100%. We still allow them into the workplace in a transitional work program so we don't have as many lost days, especially in a time when we're seeing so many staffing shortages. And then you've got the indirect costs. You know, these are direct costs. When we say workers' comp costs are going up, I can directly measure that. But we also have to consider some of these indirect costs too. Like, what does it cost when we have to pay somebody to stay over because we have a staffing shortage, or the loss of productivity because we're not inviting workers back into the workplace in transitional work? So Dr. Earl and I decided, let's put a course together specific to healthcare to help address these issues in kind of a more targeted way, looking at all of these cases and saying, let's create a course. And that nurses or others that are in employee health, occupational health settings, this course is specific to healthcare. And I'm going to share with you what we came up with. So it's a 6-module course that you're going to take over like 12 weeks, where we're going to do some actual presentation and giving you some good handouts and resources talking about specific topics. It's designed for RNs, and AAOHN is giving us continuing education credit for nurses, but it could be any employee health professional, somebody who maybe is in HR managing some of the workers' compensation. I think you would get a lot out of this course too. It's building leadership competencies in hospital safety, specific to helping those employees stay safe, work safely, and, you know, maximize their productivity while they're at work. We're going to learn practical tools. There's going to be a toolkit that you'll receive in this course that can be used by safety leadership, you know, again, geared somewhat towards the occupational health nurses and nurses who work in employee health. But honestly, there's many other layers in a hospital system that I think would benefit from this course. The program format is going to be 6 sessions delivered over 12 weeks. They'll be recorded. We'll try and make it at a time that's convenient for as many people as possible, but we all know you're going to have those times when you just can't be attending live, but we will make sure it's recorded so that you don't miss out on getting the valuable information. We're going to have interactive case studies and exercises. In fact, we invite you to bring some of your own issues into the course so that we can brainstorm and come up with solutions for you in real time. Practical tools for immediate application. This is not a sit on the shelf that I'll do one day. I am hoping that part of the cohort that we find wants this information is willing to actually do some of the work, the homework, if you will, so that you actually can make an immediate difference in your organization by taking the course. So let's look at these 6 course modules. So the first one is really looking at the expanding role in healthcare safety. And I'm going to always start with sharing total worker health principles, because I just think that as occupational health nurses, that's our foundation. It's what we're used to. We're always wanting to promote, better employee health and well-being while we're helping to prevent accidents and injuries. The business case for safety leadership. Some of you I know, need to take this to your C-suite to make sure that they understand why you're investing this kind of time and resources into a program like this. So we want to make sure that you have the very best business case for safety leadership. And then some, clinical care with safety systems oversight. We're going to talk about when do you need some standing orders from a physician, for example, to do some of your basic injury care that you can keep in-house and maybe prevent a workers' compensation claim. In Module 2, we're going to talk about regulatory compliance. Now, I prefer working with those employers that do it because it's the right thing to do, especially when it comes to safety. But we all know the regulations that are out there to protect public safety and to protect our workers in specific injury-specific ways, like medical surveillance programs. There's some compliance things that we need to keep in mind. And we know that that can be a big stick with OSHA fines or Joint Commission standards that you're not meeting, things like Medicare and those, CDC requirements. So we want to make sure we're doing those things because it's the right thing to do, but also there are some regulatory reasons behind it. And sometimes I've learned that helps to also drive change. We know it's the right thing to do. We know it's the right way to prevent somebody from having an injury or illness that's related to the workplace. But sometimes C-suite likes to also know that, hey, we're keeping you from getting a $50,000 fine if you do it this way. So we want to make sure at least you understand what that world is all about. Module 3 will really talk about safety rounds. I mean, ask yourself right now, if you happen to work at in a healthcare system and you're maybe in employee health or related to employee health, are you involved in any safety rounds? I was talking to a health center recently, and it's just their top 5 kind of leaders of the organization that review a safety incident. And I'm thinking, why is it so limited to just the top leaders? There's a lot to learn when we have any kind of safety incident, even a near miss where nobody actually gets injured. Think of all the things that we can learn so that we don't prevent somebody, we prevent somebody from having that exact same exposure or experience that might lead to an injury. So I'm going to empower all of you that take this course to really learn, how can I be a better advocate for my employers and my employees, and look at the safety, kind of open my eyes a little bit more to the hazards that are around me. I don't know about you, but when I started in occupational health nursing, I never was in a factory. I never was in a manufacturing plant. My parents were actually professionals. I had a tax accountant mother and an oral surgeon for a father. They never talked about what it was like to work in, different kinds of facilities. And maybe even in the hospital, we're used to being in the hospital, but think about behind the scenes. Like, do we know that much about facilities? And so the oxygen comes through here, and how do we make sure that that's safe for our employees? It's just another way to have an extra pair of eyes and ears out in the workforce. So hazard identification, environment and ergonomic risk. Ergonomics is a particularly special area for me. I'll share my story with you all at another time, but my first degree was in kinesiology, which really was talking about ergonomics. And I loved that I was able to marry my kinesiology background with nursing and come to occupational health nursing. There's a lot to know about ergonomics, and little tweaks that we can make in our workforce can make huge improvements in the work and the comfort that the employees have. So we'll talk a little bit about ergonomics, and then inspection and documentation practices. NAOHP actually has a great document that goes through the hospital in, different departments, from administrative offices through the floors and back, housekeeping and into the the background facilities, so that you'll actually have some resources to be able to document what you find.
Hey, Shanna,
Yeah.
do you want to know how many of our folks today are involved in safety rounds?
How many?
Well, let's find out.
Yeah, I love it.
Are you all involved in safety rounds now, or is this something you're just really not a part of? Let's see. I love that you are also participatory today. Thank you. This is great. Okay, so 2/3. 2/3
Okay,
are involved in safety rounds. That's interesting. I actually would not have expected, but that's great.
yeah.
Okay,
And
good.
and
Thank you all.
and again, this course is meant to be interactive. There might be some things that you can share with the group that you found as the best practice that might help others. That's part of what we'll have, about 90 minutes together in each of these courses. And we'll start first with some of the basic information, but it's really meant to be interactive because we find the best practices are those that are doing the work. So that's great.
Thank you.
Okay, now we're back.
Back to you.
All right.
Then
So
we're back.
module 4 is on incident investigation. And oh my goodness, can I tell you that I think that we all could use some more resources for how to do an incident investigation. Not just a root cause analysis, which happens after the incident, what caused that incident so that we can fix it so nobody else gets injured in that way, but also the proactive, how do we anticipate how something can actually happen? There's a whole process that's looking at failure mode and effects that actually comes from the military, and that can give us some really good indicators of what to look for in the future. And I think part of it too is to help supervisors on our floors actually doing a better job of determining how this incident occurred. And not just from a safety standpoint, but the other piece that I like to integrate here is workers' compensation. Again, I had wonderful mentors early in my career that taught me a lot about workers' compensation risk management. And not everything that happens in the workplace is necessarily appropriate for workers' compensation. Let me just give you a quick example. Somebody has back pain at work. Okay, they have back pain at work. But if there's no specific injury, that's not really technically why workers' compensation was set up as a system. Workers' compensation is very specific about it's there to treat work-related injuries that arise out of the employment during the course of the employment. Like it's meant for work-related injuries, not to take care of everybody's bodily problems. So the better job we do in safety investigations and incident investigation, not only does it help us prevent future problems, yes, but it also helps give some insight into, is this even a work-related injury or not? And if it's not, it doesn't mean we just, okay, forget it, we're not going to help you. We still, in employee health, want to help that person, but help guide them into the proper medical care if it's not going to be handled under workers' compensation. Module 5, we've got to talk about worker well-being. This is total worker health. And did you know that 50% of workers' comp cases right now, that employee has a chronic health condition that's prolonging the injury from resolving. So it's not resolving in the same quick turnaround that it was, let's say, 20 years ago, because our population in general has gotten a little unhealthier. So if we can always, as good advocates of health and productivity for our hospitals, not only balance safety, but also make sure that we're addressing well-being, then that's a win-win situation. We'll talk about things like burnout prevention, the value of psychological safety. Psychological safety is where people in your workforce feel like they can speak up, that they have a voice to be able to say. Now, it doesn't mean we take every single, somebody's new idea. Obviously, there's a process for deciding what we're going to do to have process improvement, but we want people to feel comfortable speaking up, and that's what safety, psychological safety is all about. In fact, psychological safety relates directly to physical safety, because in physical safety, we want employees to, if they see something that they think is a hazard, we need them to speak up. We say, see something, say something. We want those workers to say, I think this might be a hazard, before we actually have an injury. So psychological safety will definitely be a piece of this equation. And then we talked before about workplace violence. It's still, pretty hot topic right now. And we want to be able that we're protecting our workers from things like that. And there's some great best practices out there. And then finally, leading safety culture. How do we influence, maybe when we're not given direct authority over it, but we can still influence? Communication styles with the multi-generations that we have in the workforce. This has been a topic that I've been requested to speak on over the last several months. And I find it super interesting the more that I delve into it. I remember my parents would tell me when I was growing up, why am I doing it this way? Well, because I said so. And that was kind of good enough for me to think, okay, maybe I should do it this way. That's not the case anymore with younger generation. They want to know why. They challenge because they've got, Google Insights at their disposal. Just being told something anymore is not the best way to necessarily get buy-in, but there's lots of different ways that we can influence proper safety behaviors. And then, of course, the whole goal is to drive continuous process improvement, which is what we're all after. So what can your impact be if you develop better safety leadership skills? Well, the benefit for your health organization is to reduce workplace injuries, which would be awesome. Lower your workers' compensation costs. And again, some of the hospitals, they think of it as a cost of doing business. In fact, I had a leader a few months ago that I was talking to that I'm actually now in contract with. There was an attorney leader, and she says, I've tried everything. I don't know what you're going to be able to do that I haven't already tried. Well, those of us in occupational health and safety, we come at it from a different approach than, let's say, your legal team comes at it. And that's why we all want to work together. This is a cooperative effort. That's one of the reasons I chose to go into occupational health. I loved how cooperative it was. The physicians, the nurses, the physical therapists, the workers' comp administrators, we all work together to give the best outcome for an injured worker or for, advancing the health and well-being of an entire population. There's so much to know, we can't possibly do it all on our own. So we need to be able to cooperate and be able to, affect these changes. Improve employee engagement. When employees feel cared for, they're much more likely to stay engaged in your organization and not, leave down the road for, 10 cents more an hour. And you build that stronger safety culture. It's felt, total worker health is felt in an organization where people feel like they're cared about, and that the employer is really there to help them, be better. In fact, one of the things that I love to talk about is in traditional safety, we often hear that, we want you to go home how you come in, at the beginning of the day, like in a manufacturing plant, make sure you got all your fingers and toes, right? We want you to leave the workplace the way you came in that morning. When you really have a total worker health approach where you're trying to intertwine health promotion with safety and protection of the worker, you actually have an influence where could you leave just a little bit better because you worked for our organization? And that's what I think part of this class will teach you. How are you an influencer towards that goal? And of course, employee safety equals patient safety. Healthy workers are going to deliver better care. Safer workers are going to be delivering better care. Workers that are there 100% and not injured and off work are going to deliver better care. Integrated your safety culture protects the patients and the staff. And I think nurses, especially employee health, that department plays a critical role in driving safety change. You want to become a safety leader. This course is really designed to help you do that. Protect your healthcare workforce, strengthen your hospital safety systems, and lead the next generation of healthcare safety programs. I'm at the end of towards the end of my career. I'm not ready to give it up yet because I love it so much, but I'm definitely more than halfway through my career. And if I didn't have the wonderful mentors that I had, I wouldn't be able to pass on this wonderful information to the next generation. And that's really part of my passion for wanting to do this. We need to be good mentors for our next generation in the area of occupational health and safety. So the program deliverables, kind of as we wrap up here, you're going to get a participation toolkit. We're going to have lots of printed digital material that you can have that will give you access to all kinds of different worksheets and things like that can help you, a certificate of completion, and of course, for nurses, some continuing education. And we're actually having a digital credential that says that you have taken this occupational safety certificate program specific for healthcare to really send the message that you have been empowered to be a safety leader at your organization. So I'll leave it here for any questions before I turn it back over to you, Dr. Earl. And there is a Survey Monkey. I know Dr. Earl probably send that out afterwards too. We would love to collect just on this basic overview. We'd love to hear from you what you thought about this course. If you have some ideas on maybe other topics or things that we should be adding to the course, this is our kind of first go round with it. We would love to get your feedback. Even now, just from listening to the overview, we would really, really appreciate it.
Yeah, thanks, Shanna. So yeah, that's the overview for the course. You've got the whole schedule here as well. We are actually, I'll put the link right in chat here. And if you all have questions and want to know more about what is being covered, specific things that you would like to see or hear about, go ahead and put that in chat now. We can chat about it. We've got some time left on our presentation today. But yeah, this is basically the spring cohort would start April 21st, and we'll have those 6 sessions. And then we'll do another one in the fall, depending on when people are interested in getting signed up for that. So yeah, let me know if you have any other thoughts or questions in the chat, or if you'd like to come up on screen here and chat with Shanna and I about any of this. And gosh, Sean, I'm mentioning towards the end of your career. Yeah, hello. But I just have too much yet to do with this, with our OC market, with the work that we're doing with virtual orthopedics now, and a bunch of things. There are just too many exciting things that are left undone. So yeah, I'm going to be here a little while longer, helping you and everyone else get this all sorted before I am ready to sort of do something else.
And
so,
I was just going to say the registration link actually even just says, are you interested in this course? Are you interested in taking it in the spring or maybe in the fall? We would just really appreciate the feedback through that, or through the an actual survey that we can send out afterwards too.
Yeah, and we'll send this all out via email. If you click the link that I just put in chat, that doesn't commit you to anything. It just it shows us that yes, you're interested. We'd like to know whether spring or fall is better. We're not taking any money right now. That's we don't even have all the back end worked out for that. We don't want your money. We just want to know that you're interested in this and that we should go ahead with either the spring or the fall or both programs. That's really all we need to know from you as we are launching this brand new program. And if there are any other questions, I don't see anything else. But everyone's kind of sticking around. So, okay, Amanda has something. Amanda, I'm going to hand you the microphone and you can ask your question. Let's see if Amanda comes up here. How brave are you, Amanda? Or you can put it in chat. I saw your raised hand and I handed you the mic. There we go. Hey, Amanda.
Hi, can you hear me?
Hey, yeah, we got you. What's your question?
Perfect. I was just wondering if you could explain a little bit more about the CEUs, how many would be obtained and through what platform?
Sure. Yeah, it's through AAOHN. Did we settle on the number of CEUs?
Well,
Shauna?
each class is 90 minutes, so I have to do the math. 90 times 6, what is that? 540 hours divided by 60. Like that's about 9 or 10 CEs for the course, I think.
So not official yet, but it'll be in that range.
Okay, thanks. Yeah, no, I think it's a great program. Looking forward to maybe seeing more information about it. So thank you very much.
Thanks,
Appreciate
man.
it. Yeah,
Sure.
Yeah, thank you. Let's see if I can let Amanda go off the stage now. I don't know how to do that. Oh, here we go. Well, I'll figure out how to get Amanda off the stage. Kay says that blocked from my place of work. Is that the link, the tally link? Is that what's blocked, Kay? Okay. All right. I did not realize places were blocking that, but I will figure out a different way to get that out as well. Thanks for letting me know. Anyone else have trouble getting to that link, or let me know and get a different method of that out there, whether we do that through SurveyMonkey or something else. Okay, any other questions? Any recommendations for WPV prevention for hospitals?
That's a whole huge topic area. And we will definitely address that in this course. I also know that there are some other resources out there that are really starting to come out with some best practices. I know I learned those from an organization called the American Occupational Health Professionals for Healthcare. AAOHP has some information if that's something that you really need to double down on right now. But yeah, reach out to me and I'd be happy to have a side conversation if I can help you.
Okay, thanks for that. Yeah, so that will definitely be covered. Do you think maybe also including something about AI and the future of leaders using AI? Great
Sure.
suggestion.
Yeah,
we can certainly.
that might be a neat. Dr. Earl, that might be something for NAOHP to do a webinar on, because occupational health professionals are using AI quite a bit.
Yeah.
That I've seen at our last Ohio Occupational Health Nurses Conference. We had a whole talk about it, and there was probably 4 different things that they showed us how they were using AI. Of course, we all have to review it to make sure it's accurate, but boy, was it a time saver. So that's a great topic.
Yeah, absolutely. And there are certainly some prompts that we can, put out that can be used throughout the course. Yeah, we have folks who are pretty adept, and I do a lot of that myself. So
Yeah.
Sure.
In fact, AAOHN, for those of you that are in the Occupational Health Nursing American Association, I believe they recently had a course on AI for occupational health nurses also. So check that out.
Okay, good. So AI, workplace violence, problems with that form. Lisa, I will check that out and see what's going on with that. And I don't see anything else. Any other questions or comments? Which is the cost for non-members? $14.95, is what a typical course of this length would cost, it will be less than that. And with discounts, it will be less than that. All right, thank you. Will the course cover how to lead among physicians and providers in safety? Well, I think within the context of the RN role in the department, yes, certainly, because you all have to bring it together, right? This is not an isolated individual who runs this kind of a program. It's cooperative, as Shanna said. This is really a team effort. It's public health, and it's it takes a village. Particularly surgeons. With charm. Yeah, who likes working with surgeons? I came from a surgical background, so I get it. These can be challenging situations, as you know. Yes, indeed. Yeah, of course. Yeah, of course. Yeah, I think we'll have to come up with some specific strategies for that, Sean. It's a great suggestion.
Sure.
Yeah, I think it really boils down to what are best practices. And if we identify what those are and present those to most physicians, frankly, most physicians do want to self-correct when they see the data. So assuming that it's not complete ego, which is a problem sometimes, we can be candid about that, I think. Assuming that someone, looks at data and logic, then yeah, we can deal with those situations. Okay, great. Anything else? Great questions. Thank you. Maybe also include a crossover of workers' comp and ADA. Yeah, well, ADA really boils down to the essential elements of the job. So when you are looking at any workers' comp injury, the essential elements of the job, the functional demands of the job, what the individual has to be returned to and measured against when you're doing a modified duty or transitional work prescription. So yes, that all plays a part. The ADA is kind of the front end of that, is, given any impairment or disability, is the individual able to perform the essential functions of the job, or do they need a reasonable accommodation? So a reasonable accommodation is something that the company puts in for hire when it's, financially feasible, and all the other kind of rules go into place for that. In the workers' comp arena, it's part of the modified duty. What with modified duty will get us as close to the essential elements of the job as possible. Shauna, any other thoughts on that?
No, I just think functional, that's a great question to ask your organization. Most hospitals have job descriptions in place. A lot do not have functional job descriptions. They say things like must be able to lift 50 pounds. Well, how often? Is it once every 2 weeks? Is it never? Is it, sometimes it's like, well, we'll just put that in as a standard and everybody just has to do it. Well, that's not really job specific. So there's, that's just a really another great, and we'll touch on this for sure in the class because it relates so much to hiring practices for safety, return to work practices for safety. So we'll definitely do a deeper dive into that.
Yeah. Thanks, Amanda. Great question. Anything else burning in your brains? Thanks for joining us, Kristen. Okay, well, some great questions. Asked, is this recorded? Yes, we've recorded this. We will get this out so your colleagues can stop in and see what this is all about, and make sure that you can give us your interest if you had trouble with the sign-up forms. All right, Shauna, any other parting shots? Looks like we've covered all the questions.
Yeah, it's great to see everybody here today, and we hope to see you in our course.
Yeah, thanks so much for coming. All right, we'll leave it there. Have a great rest of your week.